Alright, welcome back everyone to the vocal injuries and treatments. This is Brandon speaking again. And let's go ahead and continue where we left off. We had just finished vocal cord nodules, and now we are moving on to vocal cord polyps. Alright, so what a polyp is a fluid-filled collection on the edge of vocal cords. So if you look over here, you can see like kind of some polyps forming around here, especially like right here is a really good one where it's that little red right down there with the vocal cords. And it's actually a growth from the surface of the folds. So it kind of develops from the folds and then comes out with the fluid slowly. It's like a little lump there, so it's filled with clear fluid, which means that it's a non-hemorrhagic vocal polyp. So like this one, it's kind of clear. It's really hard to see here. We'll zoom in. So if you look right here, here is kind of the non-hemorrhagic polyp because it's a little bit clearer. And if you look down here, here's the hemorrhagic vocal polyp because it actually is red, and what those are is when they're filled with blood. So we want to look out for those too and make sure that you know both of those differences. Alright, so polyps and nodules are fairly similar in how you treat them or things that they cause. There's really similar stuff. As far as symptoms go, there's hoarseness to look out for. There's kind of a flutter in the voice that shouldn't be there maybe. So listen for that if you hear it. There's a decreased range, vocal fatigue, decreased color, so vibrato isn't as much there, like it's kind of a more straight tone, and usually when they haven't been, it's a little concerning there. Throat pain as well. Again, you can do, for kind of a test, is the happy birthday test, where reminder of what that is they sing happy birthday quietly, and if they can't hit all the notes, then there's cause for concern. Again, the diagnosis is very similar to what nodules were. It's a physician has to examine it. It's just the best way to do it and to be safe. Alright, so real quick, let's take a look, before we get into the treatment, let's take a look at some polyps. Alright, here's an example of a vocal polyp that you'll be able to see. And you can see it's right there. And so when the vocal cords move, it deals with it. Here, we'll watch it one more time there. You can see right there the vocal cords are moving, but the polyp is getting in the way and bashing around those vocal cords. It's incredibly unhealthy, and so we need to take care of that quickly. Alright, let's talk about the treatment. So the treatment for vocal polyps is very similar to nodules. So I kept a little briefer on this. Catch it early. If there's problems, notice them right away. As you can see, this polyp is gigantic with these vocal folds and clearly gets in the way. And so it's very unhealthy, and you don't want anything to happen that could damage the vocal folds more. So if you catch it early, you get good treatment, and they'll be able to treat it better before too much damage happens. With the nodules procedure, do checkups, possible surgery, and vocal therapy are all things that could happen. Okay. Now, let's go ahead and talk about vocal cord paralysis. This is a very serious issue, especially because there's a lot more dealing with nerve damage, which is very difficult to treat, and it is very much a medical physician issue, not a home really remedy, but we'll talk about that in a little bit. So what happens in vocal cord paralysis is nerve impulses are actually disrupted, and it paralyzes the vocal cord muscles. So you can see over here in the diagram, these are normal cords. This is respiration when it's open, this is phonation. And you can see in the unilateral paralysis that the left cord sags a little bit, and doesn't really get used. Sorry, the right chord. And that's just him breathing alone, so it's a little closed off. Whereas the, and yeah, it's the right chord, my apologies. But if you look over here during phonation, it doesn't really close either. The right chord just kind of sits there. And so it's not really closing, so you have trouble phonating. Now, what's really bad is when it's bilateral and it's actually both vocal folds. And you can see here that respiration is going to be an issue because it's not opening up for air. It's actually very closed off. And the same with phonation, where there's no real pressure to actually phonate. So there's not enough to actually like create anything, any sound or vibrations. So clearly, after looking at these, you can see that it affects singing and breathing. It affects speaking. It affects basically anything that you do to make sound or to even get sound in. So there can be problems with eating, drinking. Symptoms are your breathy quality in the voice. It's noisy breathing due to trying to just get the air in. Loss of vocal pitch, since they can't vibrate as well. There's choking from food or water, or drinks in general. Frequent breaths, not being able to get a good deep breath, and coughing, constant coughing. So some causes that happen are some injuries during possibly another vocal surgery. Neck and chest injury, which creates the nerves into being an issue. Possible stroke, maybe a tumor, viral infections, and neurological conditions are all possibilities that really the medical staff will have to look over. So looking at vocal paralysis treatments, the biggest thing is that it has to be medical-oriented physicians, and you need to check with them. Voice therapy is a strong thing to build up those cords. Thing is that another thing that they have to try is surgeries, and there are different types of surgeries. And let's just go into what each one is. Alright, so the first one here, bulk injection, is injecting actual fat or cells that the cord has actually lost. So in order to get it, it actually moves it closer to the larynx, and that way it starts to work itself back up again and build its strength up, because it's become weak from the paralysis. Another thing is a structural implant, which allows for being able to actually put in an implant in to help the cord build itself back up. A lot of times that actually gets used and doesn't have a second surgery along with it, so it works really well. Alright, with vocal cord repositioning, what happens is they take a piece of tissue and put it on the outside so that the vocal cord moves more toward the inside as well. With the structural implant, it was an actual implant, but this is like a piece of tissue from your own body moving in and trying to reposition the actual cord. Reinnervation is taking a nerve, it's kind of like repairing the nerves and taking a nerve from your neck and placing it like somewhere to try to build the paralysis where that happened, that cord's nerve back up. And it's a procedure that often uses bulk injection along with it. Now, in the case of severe both cords shut down and are paralyzed, a tracheotomy would have to happen, which is where they cut the hole through your neck into your trachea so you can still breathe through there, and that is in the most extreme case of vocal paralysis. And with singing, this takes a great deal of therapy. If you ever want to come back, if you can, vocal paralysis is a very serious issue, so be careful with that. And give all the support you can to any of your students if they happen to go through this, or any of your choir members or anything. Give so much support and try to boost them, because it's going to be really hard for them. Okay, moving on to gastroesophageal reflux disease, GERD. What happens here is that stomach acid goes back into the esophagus, and it actually irritates the lining of the esophagus. It is important to note that this is not into the actual larynx, but rather just the esophagus. This can cause heartburn, sour taste in the mouth, chest pain, dysphagia, dry cough, regurgitation, and sensation of a lump kind of in your throat, and its frequent acid reflux is going to be the cause of that. So just kind of, if you feel any of that, get it checked out right away and make sure that that's safe. Treatment, there are sometimes antacids that can neutralize your stomach acid. You can also get prescribed medications that reduce acid production or block acid production and heal the esophagus. There are a couple different types of surgeries that you would be able to take care of too, which is the reinforcing of lower esophageal sphincter and the strengthening of lower esophageal sphincter. Over here you can see a kind of procedure that might happen where this would be open to coming back up. This actually closes off the pipe so that none of the gases can go back up easily. And that's in the serious case of needing treatment. Alright, with a laryngopharyngeal reflux disease, stomach acid enzymes head up to the larynx themselves. This time we're actually affecting the larynx. This is common in women, older usually. Some symptoms are globus sensation, having like a lump in the throat, chronic throat clearing, and a gravelly voice. So if anytime you hear any of those, raise concern, think about what it could possibly be. And then severe degradation of the voice is a huge risk, but even more so is laryngeal cancer. And so you want to be cautious of that, make sure that doesn't happen. In order to treat this, LPR treatments, primarily there's medications, proton pump inhibitor, and H2 blocker antacid, both of which will help the stomach circulate food better and will just kind of help relax everything. With diet modifications, it's very important to help follow these. No acidic foods, citrus mainly, no caffeinated carbonated beverages. So coffee, pop, all those kind of things have to be cut out. No smoking and drinking, that's clear. No dairy products, so milk, eggs, etc. Daily modifications. This is really important. You have to eat dinner earlier because when you sleep, the acid's going to want to come up early. You also should elevate the head of the bed so the acid doesn't feel, if you're on your side, it can easily come up. And eliminate vocal abuse and overuse for your vocal cords. Okay. For vocal cord and throat cancer, this is very serious as well, serious case. It can be in the cancer can be in the pharynx, larynx, or tonsils. Symptoms to watch out for are cough, changes in the voice, difficulty swallowing, ear pain, a lump or sore that doesn't heal, sore throat, and weight loss. All things of which to watch out for. I've included here the types that you can experience, which are nasopharyngeal, oropharyngeal, laryngopharyngeal. Each one follows the pharynx associated with it. The glottic, supraglottic, and subglottic are all relating to the vocal cords in certain areas. Alright, throat cancer treatments. Usual treatment that you follow here is radiation therapy. You want to look at that. There's surgery for the different types, each one progressing more and more severe. Then going into chemotherapy, targeted drug therapy, and rehabilitation. All of which you want to be very supportive during and really try to help. It's a very tough thing to go through, but these injuries can be helped, hopefully, and if not, you need to help them. Here are some resources, and